Hello, everyone, and welcome to today's RAND remote conversation. I'm Brandon Baker, Vice President of Development at RAND. I'm joined remotely by Jennifer Bouey, an epidemiologist, a senior policy researcher, and RAND's Tang Chair in China Policy Studies. She is here to discuss RAND's efforts to address the evolving COVID-19 pandemic, from what we now know about the virus and its transmission to vaccine development, the economic impact of the pandemic, and future RAND research. At RAND, we rapidly responded with research and action as the crisis began to unfold. But as the virus is still causing widespread illness, economic devastation, and long-term uncertainty throughout the world, I think it's clear there's much more to learn and much more to do to help with the recovery process. We will continue to contribute insights and analysis that can help strengthen and safeguard our communities, and to share research that decision makers can use to rethink and retool our institutions. Both are priorities of our Tomorrow Demands Today fundraising campaign. Today, Jennifer will talk more about what the coming months might look like. Jennifer, thank you so much for joining us today. We're grateful that you're spending some time with us today to chat about COVID-19. So Jennifer, as an epidemiologist, can you tell us what is unique about this virus that has enabled it to cause a global pandemic?
Yes, well, first of all, thank you for inviting me here, and thank you to all the listeners. So we're certainly living in a historical moment. COVID-19 is caused a pandemic that's unprecedented, at least in the last 100 years. So why COVID is so special? We know that COVID is caused by a SARS-CoV-2 virus. That is a novel coronavirus, the third in a row that has caused a pandemic after SARS and MERS. And this is the seventh that we know that has existed in human. But this one has certainly surpassed anyone else before it appeared that caused much more damage to our world. So partly it's because the COVID-19 caused a disease that can have a very high proportion of asymptomatic cases. That we didn't know enough in the spring. We know now that it's about 40 to 50% of the cases are asymptomatic, especially among the young adults and children. And also, even for those who have symptoms, they often have very mild symptoms in the first week, and that's when actually the transmission goes the most likely to happen. So we have this large community of people who are infected with the virus but didn't know about it, and then they move around freely, and that's why we see very quickly, within a couple months, this virus has spread throughout the world, and we got cases reported from all 6 continents within 2 months. That's basically just very amazing. The other thing that we didn't know then is that the virus not only hurting the respiratory system, but it can also affect the cardiovascular diseases system. It can affect the kidney functions, and it can affect the neural systems. So this is a multi system problematic diseases. And often when we see the symptoms not very characteristic at first, we tend to ignore that. So now we know that it can manifest in many different ways. And it also causes just enough severe cases. About 15% of the people who are infected needs more severe hospitalization, has more severe symptoms and need hospitalization. And about 5% can lead to deaths. So it also caused so many, just because the baseline rate is so high. Now we've seen over 8 million cases worldwide and over 1 million deaths reported. So that's why we see the characteristic of this new novel virus is critical to the pandemic we're in now.
So we've learned a lot from this 1918 flu pandemic. We learned that it had 3 waves. We learned that the second wave in the fall of 1918 actually caused the most deaths. So what could we expect? What should we expect of COVID-19 now and in this upcoming winter?
Yes, you're right. As I just said, that COVID-19 is the caused a pandemic in the same similar scale that we are going back 100 years ago, and we're certainly thinking about the 1918 pandemic, flu pandemic. However, coronavirus is a different virus that compared to the flu. We don't know that much about the coronavirus. We don't have a successful vaccine yet, and we don't know the effective way to treat coronavirus. So that makes COVID-19 even more mysterious and hard to control compared to other flu epidemic we have seen recently. But similar to flu the diseases, we see that COVID-19 is also transmitted through air and transmitted through droplets and aerosol. So in a way that there's some similarity between the 1918 flu and COVID-19 because they both transmitted probably most effectively in a face-to-face situation in an area that has a very confined space. So that's why we think that maybe seasonality is an issue for COVID-19, that we might expect more people have activities indoors rather than outdoors. And that contact mix can cause higher transmission for COVID-19. So that's very likely and possible. So another thing that I would like to mention here is the COVID fatigue that we do see. We have been 9 months into this pandemic, and many countries, many places, people are really tired of being having the social distancing and having lockdowns. So that comes in at the same time as the seasonality when we're expecting more higher transmission. So I think that might also compound the challenges we're facing in the fall and the winter.
You know, Jennifer, everything you just described really impacts the upcoming holiday season, which is quickly approaching. So how safe is travel going to be, and how safe are those family gatherings that are most likely going to be indoors?
Yes, so this is certainly a challenging season, as naturally over the holiday seasons, we usually see more gatherings and more travel. We get to know more about travel. There's more research coming out in the last few months. And there was one large study combined by researchers and the DoD, I think, looking at air travel specifically. And that study showing that airplane per se may not necessarily be the most risky environment. They used these particles similar size of virus, and they found that the airplane, actually the filter and the air pressure are pretty good to prevent a large transmission on the airplane. But that said, I think airplane travel is only part of the travel. I think whenever we travel, it's not just we sit in the airplane, but also, we're at the airport, we are in a new setting. The contact mix is definitely different than our day-to-day life. So that contact mix will definitely bring more potential risk for us to see more people. And many of these people might be asymptomatic or maybe having mild cases. So I would say travel still bring higher risk than our normal day-to-day life. So I think, for whichever travel is necessary, more caution need to be, bear in mind during the holiday season.
So how can we protect ourselves in a high-risk environment like that?
Yeah, so this leads us to Also the recent studies on what can be more effective. We certainly know there are many treatment programs are in the clinical trial stage. The vaccine is on the way, but right now we still don't have a good vaccine or treatment yet. So most of the intervention we're thinking now are still public health interventions. So that means changing the environment and changing our behaviors can protect us. And these behaviors, including, I think, I cannot emphasize more about wearing a mask. I think that's something that we could do best to protect ourselves and people around us. And other things like keep the social distancing and keep, if possible, activity outdoor rather than indoors, and avoiding crowd. Those, we have seen hear about this again and again in the last 6 months, but they are still the fundamental ways and public health intervention that can protect us. But I want to emphasize is that we have to do multiple things. We cannot only ensure do only one thing that can save us, but we have to combine behavior changes with testing, tracing, and with investment on the vaccine and treatment. I think together, if we do all of these things, we'll be much safer than even without a vaccine so far.
Since March, we've heard about, increase in testing. We've heard countries do tracing. Can testing and tracing help contain the virus?
Yes, great question. I think the testing and tracing and isolation of patients, those are proven successful public health strategies to contain the virus. But it only works when there's sufficient human resources and resources putting into it in comparison to the scale of the pandemic. So that's why we see it worked in many Asian countries, especially East Asian countries like Korea, in like places like Taiwan, and even Singapore. They are very successful using these technology and techniques to contain the virus. But it may not be successful. We haven't seen it being successful in most of Europe and US. I think partly just because of the sheer size of the pandemic, that we don't have sufficient resources to trace, let's say, 50,000 new cases per day. So when the pandemic outbreak is overwhelming, then we know tracing would not be useful because we just cannot trace everyone as we should be.
What about our most vulnerable populations? What can service organizations do to help the most vulnerable during a pandemic?
Yeah, so we know that certain sector of the population are more vulnerable for severe cases. People with cancer, with immunology problems, or even just with cardiovascular diseases, hypertension, diabetes, or just pure obesity or pulmonary diseases. They are much more likely to have severe cases, severe symptoms, or even higher death rate. However, looking at U.S. population, we have about 40% of the population that's having one or two of these conditions. So that means a lot of people need to be very aware of the risk of COVID-19. But at the same time, we also see that with COVID-19, lots of people are afraid to go to healthcare settings for fear of transmission at healthcare. And that increased our excessive deaths. So that, which means the deaths that not directly related to COVID-19, but happens more often during the COVID-19 pandemic. So I would say that catering affordable and accessible healthcare to people with underlying diseases and those who need healthcare during this time are really critical. So partly it's requiring the healthcare system to really protect, to separate the potential COVID cases or the potential infections from other health services that they provide. So that would be a way to help reduce excessive healthcare problems. Another way is at community level, how to catering and helping people who are affected by COVID but cannot have access to healthcare. That may need more community services and that reaching out to these more vulnerable population, including ethnic minorities that we have seen that those who are more affected by COVID-19.
Yeah. So let's turn now to a potential vaccine. Can the U.S. truly make and widely deploy COVID-19 vaccines by the end of the year?
Yeah, so for a vaccine, I think so far it's a amazing story because due to this unprecedented pandemic we're in, we see that every country globally had putting in so much efforts into a vaccine race. I mean, race against the COVID virus infection. And U.S. Also put in an unprecedented amount of investment. And globally, there are lots of scientists are working together to tackle this. And usually a vaccine would take about 10 to 12 years from the development all the way to the market. But now we're hoping to see the vaccine on the market within 9 or 12 months. So I would first say this is unprecedented. And U.S. Government has put in promises. The Warp Speed project has put in lots of investment, try to secure about 300 million dosage by the early 2021. So all of these look very promising. And right now we have invested in at least 6 candidates that are in the final stage of the vaccine trials. But that said, we haven't. We still need to give enough time for scientists to document and test out these vaccines to make sure these vaccines are safe. Several of these vaccines are using brand new platforms. They are high-tech products, so we need to have sufficient time to test it out. So I'm still very optimistic that within the next 6 months or so, we should be able to see at least some successful vaccine candidates coming out of the trial and get into the manufacturing process. And maybe we'll see the first batch of vaccine that can be distributed and sent to the people most vulnerable.
Should we be concerned about vaccine safety?
I think, in the U.S., in as many parts of the world, people should be vigilant about asking questions about when the new medical products come to the market. But I think, in the U.S., I can assure the public that as long as the vaccine is following a scientific protocol and going through the phase 1, 2, and 3 stages of clinical trials, and all of these trials are transparent and well documented, then we have sufficient scientific assurance that there's very few side effects, and the many people of different ethnicity, different background participated in the trial. Then we can say, this is a safe product and can benefit most people. And throughout the public health history, I think one of the best weapon almost to tackle the onslaught of virus to human life is the vaccine. So we have seen this successful for time after time. So I also optimistic that the vaccine, once it's past the phase 3 trial, it should be safe for the public in the United States and beyond.
Good. I'm glad to hear that. Who should get the vaccine first?
Yeah, so vaccine distribution is also a very well debated and well researched topic so far. So I think both the National Academy of Medicine in the U.S. as well as Johns Hopkins University and other research groups have all proposed some of the distribution strategies. And every state in the United States, I think last Friday was the deadline for each state to submit their plans for vaccine distribution. So I would say, we are prepared before the vaccine is available, that, certainly for how to distribute that vaccine. But that said, we still have to think about very carefully of the logistics and also think of, what is the goal especially for the first few months, what is our goal for the vaccine? We certainly want to protect the healthcare workers. We certainly want to protect our policemen or security-related personnel. And then should we provide a vaccine for those who are at highest risk of deaths or severe symptoms, or should we give vaccine to people who can go back to work quickly and revive our economic, workforce? So all of these will be still in debate, but I think we have good scientific evidence, at least now, and different plans and tools for the policymakers to work on these. So I assume we'll be ready when the vaccine is out.
So, Jennifer, what has the pandemic told us about global health systems?
So, as we have seen that the COVID coming to this year in 2020, we definitely see a unprecedented pandemic and assault on this global health system. I would say overall, as a professional in global health, we were all a little bit surprised at how unprepared we are with a pandemic like COVID-19. So apparently that we were hoping that WHO and some of the alliance we have formed in the past few years that can produce a bigger role to coordinate the COVID-19 response. But we have seen that different countries or regions have encountered quite a lot of challenge to take care of both of the country's pandemic as well as the pandemic beyond the borders. But first thing we know here is that, again, the pandemic doesn't respect the borders. So even though we see a almost worldwide the travel ban against China, where the virus appeared first, we see that didn't really prevent the virus spread widely. And then we see a lot more countries in the pandemic stage, a lot more bidding for very limited commodities, either is masks or respirators. So these activities and needs without a good coordination cause the price to go up, cause a lot of inefficient ways for countries and peoples that need it most to obtain these. So we do also hear more nationalism, protectionism comes out. So these are all call for a concerted efforts globally to coordinate these efforts by different countries. So right now, WHO do have some plans, and we just mentioned the COVAX plan that has more than 180 countries to pool resources together and to develop and manufacture vaccine, and to make sure that all countries have a equal access to a certain percentage of vaccine. So I think that would be a good effort. But certainly right now, for U.S. has not joined that efforts. So even though I think U.S. is pretty safe itself, but we may still have to worry about other countries, and we know still will have to wait till the economy in many other countries to recover to go back to norm. So I think global health have seen this, that the COVID-19 have shown all the weaknesses in the system, and we definitely need more research and certainly years in coming to strengthen that coalition.
So Jennifer, my last question for you today is, what is needed to strengthen our systems and institutions to prevent future pandemics like this from ever happening again?
So we definitely see COVID-19 affects the U.S. Severely this time, and many of us are thinking that this is very much against our thoughts that U.S. has the best defense against a pandemic like this. So this will give us a lot to study, and we definitely think the U.S. that if what we found is without a central government coordination, if different states have different plans, and we also don't have a good travel quarantine for people traveling across the borders, and then different messages from different states affecting the effectiveness of implementing of the public health interventions. So that partly cause some of the chaos and cause some of the inefficient controls of the virus. That's where we are now. So moving forward, what we can learn from COVID-19, I think it's targeting both on the healthcare system, how to scale up in a pandemic like this quickly, to talk about public health system, whether we can put in the legislation or, to give a set body that can coordinate the different states' actions. And then in terms of the biomedical research, whether we can build a platform for novel virus research that we can quickly latch on to the treatment and vaccine, and even speed up more on the vaccine development and treatment adaptation. And how can we create a clinical trial network that designed for vaccine and treatment for novel virus that can quickly build up this capacity. So I think U.S. have lots of resources, and I think the challenge is how to coordinate when something hit as fast and strong as the COVID. So I think those are among the many areas we can strengthen.
Thank you, Jennifer, for being here with us today, but also for your research and your work that is truly having an impact on fighting this pandemic. And thank you to everyone who joined us today. Our goal is to keep you connected to RAND and to be your source of trusted information. Stay tuned for more RAND remote events and opportunities to connect with RAND experts. In the meantime, feel free to reach us at randremote@rand.org. Stay well, and goodbye for now.
Times have changed since the creation of NATO and NASA, the World Health Organization, and the World Bank. From colleges and courts to the military and the media, are the many institutions we've relied on to keep us educated, safe, and informed still meeting our needs today? Technology has transformed our lives and changed the way we communicate. Speed and ease of transaction guide our high-tech world. But have they made us less safe? The networks that make it possible for you to connect with your family and friends around the world also connect terrorist groups and their followers. You can have groceries delivered with the push of a button, but there are also websites that trade in weapons and humans. Who is responsible when your self-driving car crashes? What happens when an algorithm denies you access to healthcare or a loan to start a business? From cyberspace to outer space, now is the time to rethink the roles and responsibilities of our institutions and our place in the world. Imagine a tomorrow where sound policy drives stability, prosperity, health, and well-being. Can you imagine a more secure tomorrow? We can. Tomorrow demands today.